everybody. Thank you for joining us. We are very excited about this conversation between three friends. So we're talking today about saving lives in New Jersey with the COVID-19 vaccine, but the larger issue has to do with how COVID-19 has affected faith communities and how faith communities have, in response, dealt with the needs of our congregations in light of COVID-19. I am Deforest Soaries. I'm the senior pastor of the First Baptist Church of Lincoln Gardens in Somerset, New Jersey, where I have served literally without a break since November of 1990. And with me today is a dear friend who, when the terrorist attack of 2001 happened, when September 11th hit, Imam Hamad Chebli with the Islamic Society of Central Jersey partnered with me. I was then Secretary of State and pastor of First Baptist, and he and I worked passionately to ensure that New Jersey residents rallied together, that religion or race did not divide us, and I'm so happy to be in conversation with him today. And then Father Ron Pollock from the St. John's Episcopal Church, and I'm just thrilled, Father Ron, to have you here. Your tradition has been critical to so many of our institutions in Central Jersey and throughout the state and literally throughout the country. And it's just been a challenge for me personally. We've had so many deaths in our community from the time we closed for worship in March of 2020 up to and including today. Our church has had COVID-19 as a central challenge in all that we do. So Imam, first, talk to us about how COVID-19 impacted your community and your congregation, and then Father Ron, I'd like you to do the same.
Yes, thank you. First of all, thank for everybody, and first of all, we thank God first, the one who gave us the opportunity to meet again after September 11 for all these years. I believe you are striving too much for in your church, in your state. We put our hand together for all those kind of crises, and now year 2019, 20, 21. We have another crisis. We call it, COVID-19. But thank God, again, thank God. The Islamic Society of Central Jersey, the media said about us, I'm quoting just a media, when we used to go to the Eid prayer, which means the festival prayer, in the park here in South Brunswick, and I like to thank the mayor and the chief of the police, everybody cooperating with us. The media said your congregation up to 6,000 congregants come together. This is before COVID-19. But when we starting getting the news, right away they asked the Imam with other local Imam, what you supposed to do? I said supposed to do as what the doctor will do, because I am not as the doctor, but we communicate the doctor. The minute the doctor said close the building, we close the building. No prayer outside in the parking lot. No prayer in the parking lot. How you pray, it is not our business. God said you can pray anywhere. Don't pray in congregation. And thank God I spent complete year in my home with my beloved wife. You met her when you came here in the mosque with my kids. My kids and your kids were friends in South Brunswick High School. You remember that. We did all our prayer in the home, not only the Imam, but the entire congregation. But when the governor, I like to thank him and thank First Lady who visit us 2019 in the mosque in Laylatul Qadr. I communicate with them. They said, Imam, thank you for what you're doing. You are doing good. And if you like to pray outside, you can pray outside. You know, as a Muslim, we pray anywhere in the park here or there. We start praying outside with the distance. And again, we have a death. Again, we bury people. Again, affected us. But again and again, nowadays, with the little, a way to reopen, we reopen the mosque with all the concern about us, and we are praying inside, but the weather help us, we pray outside. That is here. Concern is here. Bad economic is here. People go to the hospital is here. Exactly as it happened in your church. But thank God, we try to do our best and we leave the rest to God with the will of God.
Mm-hmm.
Thank God is right. Thank you, Imam.
Right.
Father Ron?
Thank you for your hosting and inviting me to be a part of this. And Imam Chebli, it's wonderful to walk alongside you as well today. What an honor. Thank you. When COVID hit, it impacted our church tremendously. The St. John's Episcopal Church in Somerville is part of a wider community. It's called the Episcopal Diocese of New Jersey. And if you were to imagine the state of New Jersey from Cape May all the way up to Elizabeth, New Jersey, squiggly line across the state to Bernardsville, 137 churches. Our cathedral and our bishop's office is located in Trenton on West State Street. And the bishop set up what's called a diocesan task force, and then translated to each parish, develops their own task force. We developed our own task force here at St. John's in Somerville, and we really got to work. We were quickly able to proceed in the area of pre-recording our services and then putting them online on Facebook and YouTube, able to reach out to the community and on pastoral levels, which was unprecedented before. And in my own ministry, I have found first and community responders to be real heroes. They're the ones who have been the bridge for me to, in lieu of going into hospital rooms, to simply pull out my cell phone and have the nurse hold the phone over the patient and able to pray. And that was really quite something. We've had death in the community, and which has affected all of us just tremendously. What started off as a health crisis quickly went to a financial crisis. We see people who are hungry like never before, people standing in line at food banks and soup kitchens. And so the church has been able to, in part, step up to the plate and walk alongside of our community members. And one of the beauties of Somerville is that we are the county seat. And when you're the county seat, you can reach out to your political leaders on both sides of the aisle and businesses and community, other community leaders to help us accomplish the goal of simple things such as feeding one another. And lurking around the corner is the housing concern. That will be a major concern for all of our churches.
I appreciate that perspective.
Yes.
You know, I think it's pretty well established that COVID-19 had an impact on how people are doing. We preach, talk, and pray about love, but it's times like these when people are challenged to really show love.
Yes.
And I think how people are doing has been a real focus. But we're in a unique position of not only responding to how people are doing, but also what people are thinking. When COVID first hit,
Yes.
the first challenge we had as a community, and I had as a leader, was to combat the rumor that Black people could not get COVID-19. And our first round of responses had to do with assuring people that we should take COVID-19 seriously.
Yes.
The second had to do with testing,
Yes.
and then the third had to do with vaccine. And if you look at this from what people are thinking perspective, what I'd like us to spend some time talking about is what people have thought about the vaccine. Because on the front end, we had to respond with service and love, but we also had to work in cooperation with our political leaders to look for light at the end of this COVID tunnel, and the light was the vaccine. Our community had an additional challenge because there were very key influential Black leaders in America that were informing my members that the vaccine was dangerous, that the vaccine was designed to wipe out Black America, there were a number of barriers that we had to cross. Now, we ultimately ended up being a vaccination center, but I'm wondering if your constituencies and your communities had challenges in terms of what they were thinking about vaccine. Imam?
I'm talking about the personal. I received a call from one of the outlets, New Jersey media. Imam, are you going to take the vaccination? I went back again. I said, this is recorded in some outlet media. I said, one my doctor. I said, one my Muslim doctor. The minute she will tell me, take the vaccination, I will take it. The rumor came now. Oh, the vaccination has something to go under the skin. They know who are you. I am open book. Let them know what I am. Put it or not put it. No, the vaccination will stop your heart. God will take me when he wants me. He didn't take me in September 11, nor in Oklahoma City, nor in the war in the Middle East. I am here in New Jersey. I have my grave. Which means the rumor was there to stop us not to be gathered, to avoid what the government said. Don't believe the government in Washington, D.C., neither in Jersey. We work with them. We are a human being. They are a human being. If they intend to hurt us, God will take care of all them regardless of what. The rumor are there. But we thank God. The minute the vaccination came, I took my beloved wife again, I love her, to Jersey City. I took the first and the second, I am as I am. Yeah. I lost a couple pounds because in this age, I have to cut the grass, I have to do all this. The David does that, I did affected me. And when the community saw me with the picture, the needle on my left shoulder here, they took it, and thank God, everybody enter the mosque in the month of Ramadan, praying inside. Surely the elderly come first, men and women. We give them a badge, we give them prayer rugs, we give them the water, we give them a seat and 6 feet, and all of them get the vaccination. And believe me, media either can hurt us or can be with us to encourage the people not to take a side with the vaccination or not a vaccination. The vaccination was made to save a life. Yes. If 1 or 2 or 3 or million die after vaccination, their day is finished. But let us take the vaccination. I did it. My family did it. We are children of Adam. Let us work together, and God bless.
Yeah. Yes. All right. Father Ron, did you set the example and get the vaccine and then spread the word? How did you do it?
Yes, sir. I was indeed blessed and lucky in all those words to be contacted to ask if I would be willing to receive the vaccine, and I gladly say yes. I said, if I can bring along my Baptist pastor right down the road, and we went together. And it was out of this beautiful group home for children nearby that was hosting this particular event. And I went, and it meant a great deal to me. People asked me, well, why did you get it? Why did you get it? And I just said, well, I agree 100% with what the Imam just said, which is the vaccine saves lives. But I think the question mark, and there's 2 things I want to pick up on. One is really, I think the vaccine came out a little bit sooner than some of us thought it would. So whatever you want to call that, perhaps new technology. And then the second thing really has to do with safety. So many questions and concerns about safety. What is in this vaccine? Does it have a microchip in it? Like the mom was saying a moment ago. I mean, is it going to, let everyone know that I really have a great passion for chocolate ice cream? What will it tell? But I think particularly these safety concerns were emerging in communities of color who have suffered tremendous historic injustices. And here I am in Somerville, New Jersey, and they're asking legitimate, good questions. What's in it? And so Dr. King said, we're part of the beloved community. And the beloved community means you care for everyone. You actually know what their name is. And you enter into a conversation so that there's openness and more trust and more love, just like I'm seeing on my Zoom screen right now. which is pictures of love, slices of heaven, which is people coming together. We're meant to be together. And if we're together, then we'll walk together. And when we walk together, then we could share with those in our midst who are questioning, who are doubting, who are full of fear, for good reason.
You know, it's interesting. I went and got the vaccine also, and I took pictures. And my thought was that I would share the photos with the congregation virtually, digitally, and that would encourage them. But by the time we were prepared to actually administer the vaccine, we had already had seminars with health professionals. We had already begun educating the congregation. And so the day we announced it, I'll never forget this, we announced that we would be registering people for vaccine on a Saturday evening.
Wow.
And by Sunday afternoon, over 3,400 people registered. So I never had to show the pictures.
Yes.
But we did work hard. Now here's a theological question for the two of you, because you know we're all trained clergy, and what I'd like to know is how you balance these two ministerial clergy functions. On the one hand, as Imam said, it was our job to convince people that you can pray at home,
Yes.
that God is everywhere, and that our faith is not limited to the ability to gather in a physical place. And so this was a time of really reinforcing our core beliefs in who God really is.
Mm-hmm.
On the other hand,
Mm-hmm.
we also said, but science has a role.
Yes.
And while we believe God, we trust God, we know God, we also embrace science. And you know, faith and science have had this tense relationship forever. But how do we reconcile the fact that we do believe God is all power, we do believe God is everything, at the same time we believe that this scientific breakthrough of a vaccine is in fact an appropriate response for people of faith?
Let me go back to the Torah, to the New Testament and the Quran. I am more familiar with the Quran. I have it here in front of me. But the other book, I have them in my shelf. I can bring it to you. Now, there is a couple verses in the Quran. It challenged me, it challenged all the doctors. Let me say about how God created the fetus from the drop of man and female, sperm and eggs, and all this thing is written 1400 years ago. That will prove that true science is a true science, and Muslims believe in it. That's one thing. That's the reason I went to the vaccination. But if in emergency, we cancel all those prayers to save the life of the human being. God knows we are weak, and He knows we can worship Him in certain time, but in certain time we cannot worship Him. And I agree with the father when he said, I carry my cell phone with the hand of the nurse, with the gloves, above the patient, if he's sick or not sick, to pray through the media. God doesn't need a cell phone, doesn't need Imam Chebli to be in the Zoom, doesn't need my older friend, to be today here. He knows what we are doing. But my little concern is, again and again, rumor is separating us from God and separating us from each other. And thank you for giving me this couple minutes, and God bless you.
Wonderful. Thank you, Imam.
Nice. Thank you for those words. The whole medical community, they have really helped us walk a journey of being formed. When I question, I have to go to the science. I have to learn about what is the process. And I've learned so much from doctors, and there's an epidemiologist who serves on our diocesan task force, and he is just not only a wealth of information, but a real man of faith, and how he merges these two components of his life to help shape, form, mold people in their own faith journey. And I'm forever in their debt to tip my hat to say thank you to all those folks who really have led the way. And theologically, one of the components about community has to be about what I will do, not for self, but for other.
Right.
And when you think
Amen.
beyond your nose to other, then you're putting your brothers and sisters ahead of you. And when that happens, community happens. If I may say, God happens. We're able to come to a clearer understanding of so much that confuses us when we're given the wrong pieces of information. We want to be given the right pieces of information.
Not only do we see no contradiction between faith and science,
Yes.
our faith allows us to celebrate God's work and God's hand in the science.
Yes.
It's the human mind that crafts the scientific strategies, and it's God who provides the human mind. As both of you have said, we've gotten so much help as a faith community from first responders, from healthcare institutions, and from government. As both of you know, I spent some time in state government, and notwithstanding my own experience, I have never seen the state of New Jersey mobilize government resources, create partnerships between government and communities and faith institutions, and use the media so creatively to get the word out about this vaccine. And I am one who has become somewhat skeptical of the effectiveness of government, not in a partisan way, but government has changed a lot since Imam, you and I were working together around September 11th.
Yes.
Now that we see that the vaccine is pretty much available everywhere, and now that we see what government's doing, what's left for us? What's left for our churches, our mosques, our cathedrals, our synagogues? What's left for the communities of faith to do, or should we just allow government to take it from here?
I will never try to blame the government regardless what they did, but I like to blame myself first. Did I give them my message? Did I visit them? Did I invite them? Did I tell them about my concern ahead? Because here I like to inject one thing allowed me. In Islam, we live with two words in Arabic. Let me give you two words in Arabic free of charge. One of them halal, haram, lawful and unlawful. Okay. If somebody doing something unlawful and I don't tell him what you're supposed to do, it is unlawful, I blame myself. I don't blame that person. Give you example. Some Muslim want to open a liquor store. I'm not talking about legal or not legal. And after they open the liquor store, oh, Imam, is it okay to? I said, no, you didn't ask me first. If you ask me first, I will say no. My point is, if we put our hand together and we learn many lessons, our concern is the life of the human being, not the building, not how many acres, not how many people. No, it is saving the life of the human being. If we don't do that, I think the government will walk in our body and they will never care about us. What is left for us? Are we doing our homework? That's the question. I will leave it to the both of you. If you need my help, with the help of God, I will be with you working that. And thank you for giving me this time.
Thank you, Imam. Father?
I am so in agreement of the walking together, that we walk hand in hand. And we do have a tremendous responsibility. Whenever we gather for community outreach, and in particular justice-oriented community gatherings, such as the soup kitchen and the food truck and the laundry love and the reaching out to food banks, yes, we can bring flyers and share with those who have not heard the news about where and when they too can receive their vaccines, and then to help demystify or demyth some pieces of information that's been shared with them. That, yes, we can walk alongside them and let them know of what the truth might be.
Yeah, and the fact is, we found, which I'm sure you have also, that there are people who trust us, who trust the church, who trust the synagogue, who trust
Yes.
the mosque, that are more skeptical of secular institutions. We found that, for instance, there were people who preferred driving to the church to get their vaccine for over an hour, over going 5 minutes away from where they live to a secular or government institution. And so we do have an obligation. You know, from a community planning perspective, the legal reason churches and mosques and synagogues and religious institutions don't pay taxes, local taxes, is because there's a doctrine of inherently beneficial use of land. And so legally, we occupy land. We don't pay property taxes like homeowners do. We probably would go out of business if we did. Because society has deemed that to have a religious institution in a community is inherently beneficial. But it's only inherently beneficial if we go beyond the four walls and beyond the property of our physical space, and in fact offer benefits to the community beyond our own constituents. And I think my respect for both of you is located right there, because I know both of you are concerned about humanity. You're concerned about the quality of life and community, and both of you have demonstrated moral leadership of any sectarian or any particular dogmatic belief. So I want to thank and honor both of you for representing, I think, the best of our clergy tradition. And as I thank the state of New Jersey for their willingness to partner with us, notwithstanding the need to keep church and state separate, it's not separate when it comes down to cooperating to affect the quality of life of our people in our state. So I'd like to thank both of you for your time. I know you're busy, but you made time for this important conversation, and I'm grateful to you. I'm certainly grateful for those that listened in on the conversation. It's rare that clergy are willing to talk and have their conversations recorded and played publicly. So you witnessed something that we do in private, but because of the urgency of this moment and because of the critical need for all of New Jersey to be vaccinated, we wanted you to have access to this conversation. So thanks to the state of New Jersey, thanks to Governor Murphy and his entire team that have really led this effort as champions, not in a partisan way, not in a geographically partial way, but for the whole state of New Jersey. We are one state. We have many faces, but we're one family. If you'd like to learn more about COVID-19 vaccine in New Jersey, just go to covid19.nj.gov, G-O-V. That's covid19.nj.gov, gov. And if you /vaccine, go to that site /vaccine, and you'll find out all of the information that New Jersey government has assembled to ensure that we understand the vaccine, that we have access to the vaccine, and that the vaccine is distributed wherever people will have it. So thank you. God bless you. My brothers, I pray that
Thank you very
God
much.
will continue to use and strengthen both of you.
Thank you.